Kenyatta is appealing to healthcare service providers to include palliative care as part of primary healthcare packages offered to Kenyans. The First Lady said provision of palliative care, which she termed as a human right, would help lower the nation's disease burden. She challenged healthcare stakeholders to ensure such services are available across the country.
The First Lady Friday unveiled Kenya's first national palliative policy, saying palliative care is critical in restoring dignity to those suffering from terminal diseases.
Palliative care is recognized as a human right because of the rising burden of non-communicable diseases that have caused life-limiting illnesses to millions of people globally. It requires creation of systems and adaptation of how we deliver health care.
The First Lady spoke during the opening of the Nairobi Hospice, where she called for capacity building community health workers.
However, more needs to be done to increase awareness amongst policymakers, health professionals, and the public about palliative care and its benefits. All this is possible if we improve our advocacy and education on this subject so that we apply it at all stages of disease management, from early diagnosis rather than end-of-life treatment. I urge that we find solutions that will accelerate the integration of palliative care across all levels.
She lauded the Ministry of Health for developing a care policy which she said will help accelerate provision of the key service in the country.
I believe that this policy will go a long way in identifying solutions and paving way for increased allocation of resources to establish more palliative and hospice centers. It will also provide the necessary template for provision of affordable medicine and treatment for managing symptoms.
Health Chief Administrative Secretary Dr. Mercy Mwangangi said the new policy will help steer the government's ambitious plan to increase the number of palliative centers in the country.
We need to talk about how do we finance palliative services, what is the role that NHIF will play, and Your Excellency, I must say, through the engagement of different partners on this podium, we've been able to review the benefit package, the UHC benefit package, to ensure that components of palliative care are included, and with increasing fiscal space to ensure that we can include more and more services in that benefit package.
Reporting for Easy Friday, I'm Jackie Wambiru.